everyone. My name is Tanya. I'm patient coordinator in IVF Center. And today I would like to share with you some information about our IVF Center, how we approach our foreign patients, and how do we increase our success rates. Let's start. The name of our hospital is Gynemed, and our IVF Center is Turkish pioneer in obstetrics, gynecology, infertility treatment. It's in service from 1988, started as a medical center, mainly specialized in obstetric and gynecology. And with the honor, we must say that it's reputable infertility center in Turkey. It's a really big center with emergency service, radiology, contracted laboratory services, delivery room, many rooms to have a rest, and all the stuff which is needed. It's all well organized. We also have centers, our branch in Serbia, Basra, Koza, Baku, and Istanbul. Our second branch in Istanbul is located in the Asian side with the name as Med-American Clinic, and on the European side, American Hospital. We have really big multilingual team with 200 employees, with 100 physicians and 10 embryologists. Our Dr. Teksen Çamlıbel, it's a chairman and founder of Gynemed Hospital. He started the first private IVF clinic in Turkey at International Hospital in 1990, as he was also the chief and obstetric and gynecology department. And we came to the topic, how do we approach our infertile couples and how do we improve success rates? IVF treatment takes in total 20 days. We start on cycle day 2, so our couples need to be in Istanbul 1 or 2 days before the cycle. Total treatment takes 20 days, and on the second day of the cycle, we start the treatment with initial tests. Initial tests for the couple, for men and women. For the women, there are hormonal tests at TSH, FSH, LH, MH, estradiol, prolactin, and full gynecology scan, and sperm tests for the men. According to the tests which will be done, the doctor will decide the dosage of medications which will be used by the woman every day with specific dosage, and will be follow up with the doctor every 3-4 days. After the stimulation medication usage, we will give women's trigger injections. We give our patients trigger injections to make them ovulate, and after 35-36 hours of these injections, a collection will be done. A collection done under general anesthesia, it takes around 55 minutes, and on the same day, husband should be present with the patient in the hospital to give the sperm, the sample, and after that, ICSI will be performed. ICSI, it's a technique sperms are directly injected into the egg cells by the special microscopic machine under the guidance of the embryologist, and fertilization happens. The next day after ICSI was done, we will tell our patient about fertilization of the embryo, and we will let them know every day how the embryo is developing. After embryo development, we do embryo transfer. Embryo transfer we prefer to do on day 3 or day 5. The best is day 5 because the embryo reaches blastocyst stage. Embryo transfer is a fast procedure, and it takes around 1 hour. After this, the patient will have a rest and will go home. After 10 or 12 days after the embryo transfer was done, the patient will do the pregnancy test. Pregnancy test they can do in their own country because they do not need to stay here 10 more days, and there is no any risk to fly after embryo transfer. In case the IVF didn't work this time, the patients may come next time just for frozen embryo transfer, and it will take in total just 3 days. Another topic, how do we improve success rate for our patients? We have some procedures, some treatment for the patient who had multiple failures, and one of them is ovarian rejuvenation, PRP-rich plasma platelets. This procedure is done under anesthesia, and we advise to do for the woman who had multiple failures, who has low AMH and high FSH. This procedure is done in 1 day under anesthesia. The blood is taken from the woman, from the patient. It's worked in centrifuge and then injected back to woman's ovaries. This procedure helps to improve quality of the eggs, quantity of the eggs, sometimes is increased AMH level and reaction to stimulation medication. Another treatment is endometrium scratching and uterus PRP. This procedure is done to improve the receptivity of the embryo, of the uterus for the embryo, and increase chances of the embryo to implant to the uterus. Sometimes we give to our patient pre-treatment with supplements. There are some vitamins like folic acid, Impril, DHEA, but this medication, this vitamin should be prescribed just after consultation with our doctor and our team. Genetic testing is also a very nice way to test the embryo and to try to skip for one miscarriage, because genetic testing check the chromosomal diseases of the embryo before it will be implanted. Another new technique, it's in vitro activation. It's very new technique done by our Professor Teksen Çamlıbel. It's done under anesthesia laparoscopically. The piece of the embryo, piece of the ovary will be separated into several parts and reattached back. This will help patients to increase the AMH level and decrease FSH level. We believe that patients who are in menopause or premenopause will have very good results after these procedures. How to start IVF journey with us? Firstly, we would like our patients, our couples, to send a test to consult with our doctor, and this consultation will be free. Then the patients, our assistant or our coordinators will help with everything they need from start to the end until we will not meet them in Istanbul in an airport. I will help them with accommodation, with airport transfer, in all treatment from the beginning till the end. You can see some review about our IVF center on the link which you see on the screen. And if you would like to ask some question, to get some information, to have free consultation, you can see our website, email address, and WhatsApp number. We are available 24/7. We will be more than happy to see you in Istanbul, in our clinic, to offer you our services. Hope to see you soon, and thank you for your attention. Thank you for your question. This is the most common question which is coming from our patient when the woman have PCOS syndrome. First, no worries, because it's not a big problem and you are a good candidate for IVF. You will have a smooth journey. Firstly, we will stimulate you in our country. You will have a collection and your embryo will be freeze. Then you will come after 2 months to have frozen embryo transfer, and we believe you will have a good success rate and you will have positive result. Thank you for your question about low sperm count. This is the main reason also of infertility with which couples apply to us, and our embryology doctors will do all possible to make the eggs fertilized, because each of spermatozoid will be chosen by the embryology doctor and will be injected in each egg of the partner, and the fertilization will happen.